Let's talk about the big day, the VG discharge. Okay, the VG discharge is a natural process which helps to clean the VG, lubricate the VG, and also fight infection around that area. The amount and the consistency of this VG discharge varies from person to person, and it changes throughout the menstrual cycle, okay, which is absolutely normal. It is also normal to have a slight discharge every day with little or no odor at all, which is usually clear or milky. Okay. This clear milky veggie discharge, which is considered the normal veggie discharge, is seen more often during occasions like this when you're exercising, just before your ovulation, and when you are sexually aroused. This discharge are seen more during this period. Okay. Just before the ovulation day, within the fertile window period, this VG discharge appears to be wet, slippery, and stretchy. The one you people call ovulation discharge, kind of egg white in nature. Okay, but this discharge, it is not seen on the day of your ovulation. It is seen just before the ovulation comes. If the VG discharge becomes more thick, white, or kind of whitish yellow like a cottage cheese, sometimes this discharge can be watery and has a smell different from the usual normal VG discharge. It could be a sign of vaginal yeast infection. If the VG discharge is thin, gray, or green with a strong or fish odor, it's an indication for bacterial vaginosis. Okay. If the VG discharge is yellow or green in color, it could be a STI, that is sexually transmitted infection. Okay. And if it is reddish in color, that could be an indication for your period. Or if you're pregnant, it could be a sign for a miscarriage. Okay. If it is light pink color discharge you're having, this discharge can also be seen during implantation. That is when the fetus attached to the wall of the uterus, or most times during your ovulation when the follicles are being released from the ovary. It can be seen as well. And if it is brownish, that could be a sign of beginning of your period or you're ending your period. Sometimes it could also be a sign of infection. Okay. If you're having an abnormal VG discharge, do wait to talk to your doctor about it, or you can always access the hospital yourself. So, guys, bye. See you in my next video. After taking your baby for an immunization and you're back to the house, probably the next day you notice the site of that spots where that immunization was given become swollen or kind of reddish. Now listen, you shouldn't go about looking for hot water to press that area. Don't do that. All you have to do is look for a clean handkerchief. Okay, get an ice and put, that is ice block, put inside that clean handkerchief, place it at that site. Okay, it will help to reduce the inflammation, the swelling, and the redness around that area. You don't need to do more. And if your baby have a fever after immunization, all you have to do is to give the baby paracetamol. Depending on the age, you can give syrup or drop. All right? Bye.